The study that I just presented is a large randomized controlled trial conducted in low socioeconomic housing clusters in Mumbai, India. This looked at a simple, effective method called visual inspection with acetic acid as a cervical cancer screening method in low socioeconomic conditions. This study was planned for 16 years, where we planned to do 4 rounds of cervical cancer screening with VIA at 24-month intervals, followed by monitoring at 24-month intervals for cervical cancer incidence and mortality. Although it was planned for 16 years, the Data Safety and Monitoring Committee advised us at the end of 12 years to analyze the data because the data looked good to them. So at the end of 12 years, we found that there is a significant 31% reduction in mortality in women who were screened with visual inspection of acetic acid versus the controls, women who were not screened for cervical cancer. The other important take home is if you put adequate efforts in terms of communication and good communication with even communities which were completely naive to cervical cancer screening or cancer screening in general, if you're able to take up those challenges and inform and educate all the gatekeepers in the community, then you get excellent participation rates. For example, the participation rate for cervical cancer in our study was upward of 80%, which is usually not seen even in developing countries' cervical cancer screening programs. We also, to make it very sure, instituted quality control measures where 5% of all women who were screened by the primary health workers were also independently screened by an expert, and the agreement rates were upward of 95%. That converts to a kappa coefficient of about 0.84, 0.85. So on the whole, we were able to develop a method and a strategy to provide access to affordable cervical cancer screening for women in India and in developing countries who do not have that kind of access at this point of time.